distinguished ladies and gentlemen, the Bishop of AGC, our friend, Colonel Graham from Samaritan Pass, the World AGC Group led by Mr. Shofa, World Gospel Mission. Distinguished ladies and gentlemen, I'm really, really happy to be part of this momentous occasion when we celebrate this iconic building. And I thought it was meant for heart surgery and treating people. But we have been told ably that it is actually a place to preach the gospel of Jesus Christ. I must admit I have never seen a church like this. Universal health coverage is central to our mission of enhancing the health of Kenyans, increasing efficiency in the provision of essential public services, mobilizing local and foreign investment to develop industrial capacity and competitiveness and complement national development efforts. One of our foremost fundamental commitment in the bottom-up economic transformation agenda is ensuring that every Kenyan, everywhere, has access to quality and affordable healthcare at all times. All efforts and investments that complement this commitment are therefore very highly valued. The investment I see here speaks to the heart of our mission and agenda to make healthcare universally available and accessible to all Kenyans. Without a doubt, the official opening of the AGC Tenwek Hospital Cardiothoracic Center consistent trailblazers and pioneers who have set new standards in serving communities through inclusive and transformative strategies. For more than a century, they have played a vital role in our healthcare system. Since its founding in 1937 by the World Gospel Mission, Tenwek has steadily transformed itself from a small mission hospital to a modern 400-bed facility which provides high standards of service and care to millions of Kenyans regardless of their financial situation. The opening of this new facility builds on that legacy and strengthens our healthcare infrastructure as a country. We not only see faith-based organizations as the government's trusted partner in delivering for the people and transforming Kenya, but we also consider this partnership essential to the achievement of universal health coverage in Kenya. You know, many people would ask, what is a church doing? You know, an organization that's supposed to be holding the Bible and preaching the Word of God, what are they doing building a hospital? It speaks volumes to the partnership, the win-win outcome that comes when the state and the church work together, when the private sector and public sector work together in a collaborative manner. We get results that make everybody a winner. And therefore, I want to commend our mission hospitals across Kenya. They have come through, they have become reliable, trusted partners of the government of Kenya in the delivery of health. And it is part of the reason why we made healthcare one of our pillars in the next 5 years to make sure that we not only make health affordable, but also accessible. You are, by providing this facility, the kind of services that will be provided by this facility, people will need to travel to India to get them. But now we don't have to. We can find the facilities here at home. And I must commend Samaritan Pass and all the other partners. I know many people have contributed to make this facility what it is today. And to complement these developments, the government is implementing bold healthcare sector reforms to enhance financing, regulation, investment, digitization, and the provision of adequate, skilled, and motivated professional personnel to deliver UHC. Towards this end, I signed 4 key laws last year: the Social Health Insurance Act, the Primary Health Act, the Digital Health Act, and the Facility Improvement Financing Act. Through the Social Health Insurance Act, the Social Health Authority has been established to replace the National Hospital Insurance Fund and administer primary healthcare funds in a way that ensures every Kenyan, especially those who are needy, vulnerable, or living with chronic conditions, receive high-quality care. Primary health care is now free at all dispensaries and health centers, as well as selected hospitals, while ambulance and emergency services are available nationwide, free of charge. And I want to say this, that many people ask me, why do we have to pay for other Kenyans? Why do we have to pay for the vulnerable? How is it our business? And I want to encourage all of us that either we contribute or finally we will end up in Harambe and we will still contribute. So I think it is much more structured. If you contributed through SHIF and SHA, I think that way it is more structured, it's more organized, and it is our intention to make sure that we get rid of the Harambes that are going on in villages and places for people who require health care provision. It is our intention to make it much more easier. In the past, facilities had to be subjected to a lot of unnecessary hurdles. Today, under the UHC program, hospitals, so long as they are registered by the professional body that is in charge of registration, they don't need to know any officer of the Social Health Authority. They will automatically be brought into the ecosystem to provide health care anywhere in Kenya. Secondly, through the digital ecosystem that we are building, we want to get rid of inefficiencies, we want to get rid of pilferage, and we want to get rid of loss of funds and corruption that had undermined significantly the National Health Insurance Fund. It is through this mechanism that we can reinstate the trust of citizens on a healthcare system that is leakage-free. And thirdly, we've had serious challenges, and I have never met members of the clergy who have not asked me, Mr. President, what about refunds from NHIF? Including this morning, in this hospital, I was being asked, NHIF owes this hospital 550 million. That's a huge amount of money by any standard. We want to get rid of this challenge of funding. And I want to promise you that we are taking steps, as I announced on my statement in Mashujaa Day. Today, the money that I promised, 3 billion shillings, is now with SHA. It will be, I'm sure, the administrator of this hospital, you will get some money. Maybe not the whole 500, maybe 100, maybe 200 million. And we will continue this journey because it is my intention to make sure that we have a fit-for-purpose health delivery system that leaves nobody behind. And it is also our intention to make sure that it is not discriminatory. For a very long time, people with jobs, people who can afford, are the ones who went to hospital. We want to make it universal, and we want to make everybody, including those who are vulnerable, including the poor, can go to hospital, be treated the same way all of us go to hospital and we are treated. Primary health care, as I have said, is now being delivered in our hospitals, and under the Social Health Authority, the package of eligible benefits include cover for specialized services like cardiothoracic surgeries, which will be offered at this new center to the best global standards and available to every Kenyan who will be registered. And I want to ask citizens of our country, we've asked members of the provincial administration, from chiefs to everybody, to make sure that every citizen is registered. We've also engaged our community health promoters to make sure that every citizen is registered. And I want to ask every Kenyan, wherever you are, the first step that you must take is to be registered. That way, we will have you in our database, and we will be able to begin the journey to make sure that we can account for every citizen, and we can account for whatever prevalence of diseases in different parts of the country, and prepare ourselves. Because it is said, forewarned is forearmed, so that we can prepare ourselves better to deal with the health challenges that face our country. So I'm asking every citizen, wherever we are, to make sure that you're registered. I'm very happy that we are making very steady progress. In the last 1 month, we have registered and brought on board 13 million Kenyans. We believe that this exercise can be concluded in the next 2 to 3 months. We should be able to have every Kenyan registered, so that we can be able to have the requisite information for us to undertake this very important program of managing the health of our citizens. Let me also say that the authority, the Social Health Authority, will enable millions of Kenyans access advanced care at facilities like this one without worrying about exorbitant costs. Similarly, the Digital Health Act has been enacted to provide a robust framework for streamlining healthcare processes through digitization, covering every aspect of patient registration to the verification and payment of claims. This framework significantly enhances transparency in healthcare service provision and helps eliminate corruption. We have incidences where some hospitals in the past had more accountants than medical personnel, because the story was to generate as many fake claims as there could be. That must be brought to an end. And I'm very confident that the digital system that we have put in place will sort out that problem. We are keen to make sure that every cent that is made available through this program is spent in ensuring that we treat the people of Kenya as Jesus heals them. This framework significantly enhances the transparency, as I have said, and since July 2024, 13 million Kenyans have been registered with SHA, and all public facilities are now integrated with the system, while half of private facilities across the country have been registered. The private facilities that among those that have been registered and that are in this system is Tenwek Hospital, and I must congratulate Tenwek for leading the way. We invite the people of Kenya to experience dignity, efficiency and transparency and professionalism under our UHC model. The center we are opening today represents this new era for healthcare in Kenya with world-class care and make it accessible to as many people as possible. It is also an institution with immense pressure on the invest in education and training, research and development, as well as innovation and transformation, in order to continue blessing the people of Kenya, miracle of healing. As we celebrate the opening of the Tenwek Mission Hospital Cardiothoracic Center, I must emphasize the essential value of prevention and the vital importance of promoting early diagnosis, public awareness, and healthy habits in reducing the disease burden and keeping our people healthy and happy. Finally, let me thank all the stakeholders and all the people who have brought this home. I know it's taken a lot of coordination, it's taken a lot of effort, commitment, resources to get this here. And I must commend the healthcare practitioners in Kenya and all the people who have come together. I know there are some outstanding issues that have been requested from different stakeholders. Let me give assurance to the missionary community who have requested us to review their work permits and their visa requirements for them and scale them down. I want to agree with you that that is an area that is of concern to missionaries, and therefore we will reconsider our position and bring missionary class of visas to the level that you have requested, so that we can be able to continue to work with you as you provide service to our nation. I thank the World Gospel Mission, the Africa Gospel Church, and the Tenwek community for their exemplary and transformative service to this region and to our nation since 1937. I also express my gratitude to Samaritan Pass for their critical support for this project, and for my good friend, the grandson of Billy Graham, let me describe you that way, for coming all the way to be part of this event today. It demonstrates your commitment to humanity, and it demonstrates Samaritan Pass commitment to service to humanity as you serve God. So we're truly grateful. Please take our greetings to Franklin and to your family and to all the people in that space. I know Bishop has said that people like Russell White. Can we clap for that gentleman? People like Russell White deserve to be our heroes. I think, Bishop, they deserve more. I mean, sometimes you wonder how saints look like and whether they walk. I must say, looking at White, he belongs to the sainthood. You know, people who commit their lives, move away from their countries, go with their families to serve humanity. They are nothing but saints. And so, to you, Russell, and your team, and to the many dedicated people who've thought about this, agonized about it, planned about it, and today we celebrate the reality, we are truly grateful to you and to the members. To Colonel Graham, please convey our appreciation to your entire team and to their excellent work, selfless dedication, and invaluable contribution. The Tenwek, ladies and gentlemen, it's now my pleasure to declare the Tenwek Mission Hospital Cardiothoracic Center opened. God bless you. God bless all of us. God bless Kenya and all our friends and partners. Asante sana. Thank you very much.